What we want to do is clear in our minds and our hearts. We seek universal health coverage that leaves no one behind. Under the National Health Insurance Scheme, all citizens and residents will have access to a comprehensive package of healthcare services, including preventive, curative, rehabilitative, and palliative care. The National Health Insurance will pool resources from government, employers, and individuals to create a sustainable and equitable health financing system. We know that the challenges ahead are real. We are aware that building this system will require innovation, partnership, and strong governance. It is, however, achievable. We have the will, and most importantly, because we want to achieve this for our people, we'll make sure that it happens. From healthcare workers to policymakers, from traditional leaders to youth advocates, all of us must play a role in making this vision a reality. As the new government, the National Health Insurance is our collective solution, designed by Botswana, for Botswana, with Botswana at heart. Through the NHI, we will achieve financial protection for all, strengthened regulation to safeguard your rights as a Motswana, a customer-centered, people-driven healthcare system, accountability and transparency at every level of service delivery, stronger collaboration with the private sector, development partners, and communities. A revitalized primary healthcare system where prevention and health promotion are given the highest priority. At the core of NHI is a fundamental belief that healthcare is not a privilege. It is a right. Thank you very much. As a human rights inclined government, we will build a system that is responsive to people's needs, a system that listens, learns, and improves continuously. Community involvement will not be optional. It will be the foundation of this NHI. We will strengthen community engagement platforms to ensure that your voices are not only heard, but also shape the policies, plans, and services that affect your lives. We are committed to creating an accountable health system where every pula is used wisely and where quality standards are continuously monitored and enforced. We will establish strong regulations. These regulations are not intended to burden providers, but to protect the people. Regulation will ensure fair pricing, safe services, and equitable access. No Motswana must ever be left vulnerable to financial hardship because of healthcare costs. Ladies and gentlemen, this transformation will require boldness, innovation, and unity. A resilient healthcare system does more than treat diseases. It safeguards livelihoods, strengthens communities, and upholds the dignity of every citizen. It is the foundation for a society where health is a right, not a privilege, and where no family is left vulnerable to financial ruin. As we embark on this ambitious journey through the National Health Insurance, we reaffirm our commitment to wide and transparent engagement. We will consult our people, hear their voices, and remain steadfast in upholding the highest standards of integrity, accountability, and service. It will not be easy, but it is necessary. Health is not built only in hospitals. It is built through all sectors of our society. We will strengthen partnerships across ministries, across sectors, and across communities to address the full determinants of health. Together we will ensure that every child, every mother, every elder, and every family enjoys the full promise of quality health care. Together we will strengthen the pillars of resilience in our health system to ensure that we are prepared for any epidemic or emergency that may arise. We will deliver high-quality, people-centered health services for all Botswana. Fellow Botswana and residents, I therefore pledge that this journey will be a participatory one. You will be partners and not just recipients. Your satisfaction, your safety, and your well-being will be our guiding stars. Fellow Botswana and residents, I therefore pledge that this journey will be a participatory one. You will be partners and not just recipients. Your satisfaction, your safety, and your well-being will be our guiding stars. Ladies and gentlemen, I want to talk about the recent developments in the Ministry of Health, which is the establishment of the NHI Project Office. This is the office where all your submissions will be coming to. Your submissions will not be coming to the minister, as much as I would like to see all of you in my office. But we have been deliberate and intentional about setting this office so that all submissions from all the different sectors can be routed to a central point and they can be considered from there. Submissions will be received in a multimodal fashion, meaning you can send it through email, you can send your submissions physically, and because having been in the diaspora for a while myself, know how it feels like to miss out on important initiatives that happen in your home countries. We intend to engage the diaspora. We will have virtual town halls where they will be able to engage with us and share nuggets with us about how to develop this NHI. The intention is that in the end, the product that we end up with will be a proudly Botswana product for Botswana and by Botswana. That is why we need everyone's engagement.
What I think we need to do is to invest in a state-of-the-art information system. Yeah. We need to have details of every single citizen, what they are suffering from. Data is what plays the major role in it. So what I would say is, the very first thing, you need a robust, complete, strong, you name whatever, a strong information system which would have complete details of all the citizens of this country.
I would propose that some of the key policy documents that exist that can support the national health insurance, including finance, sector financing, just to be finalized, to really, make sure the process goes. But also, too, as we continue stakeholders' engagement, let us also consider perhaps piloting the NHI in some of the few districts to also learn to really see what happens in practice when you put it on the ground. And then you pick some lessons and then you continue moving forward.
One expects that as much as you want to minimize the financial impact, government should be able to offer a service that like I said earlier, there's a complementarity. What you would hope that government is going to move towards is being able to strategically acquire health services for the citizens at the same quality and possibly at the same level of efficiency as what the medical aids are doing.
Well, the other thing is, when you look into national health insurances, it needs to be quite well grounded in policy and in law, such that it is not then subject to political whims. Right? You could have, for instance, a president who comes in and says, I'm going to get rid of Obamacare. Give you an example. I don't know what they'll call it. Maybe it will be Congo Care. So someone else may come in and say, I'm getting rid of Congo Care. So that is also a key aspect that, we look into the Winter Parliament. I think it's going to have to do quite a good job to ensure that the legal foundation and framework upon which the NHI is based is one that is available by the person who just comes in and wants to get rid of it. Those are the keys.
Right? For us or for our facilities to be able to communicate with the private facilities and the insurance companies, we're going to need that strong digital backbone. So we are working on that at the same time. And I've been informed that for those of you who already are ready with your submissions, You can make your submissions at Office 10A21. That is how serious we are with your engagement. And those of you who have digital copies that you would like to send, I trust Ranyanga will share this information also with all of us on our pages. You can email nhinsurance@gov.bw, nhinsurance@gov.bw. So we are ready, and we'll communicate more engagements as we go forward.
The ICM, International Confederation for Midwives, have clearly stated that the theme of this day is midwives critical in every crisis. They say this because